9 days ago, we probably had 70% of this sanctuary filled at Christmas Eve. It was great, and everybody felt the lightness of the mood, and yet a week later, here we are again. I'm going to read you some statistics that you've probably heard on the lay news. The new Omicron variant, really only identified in November, has kind of swept the world and our country. In the last 7 days, just under 400,000 new cases are diagnosed each day. That's up 100% from a week ago. The 7-day average for hospitalizations is just under 90,000. That's up 20%. In not just the illness section of this, if you look at how society's doing, yesterday over 2,000 flights were canceled. Multiple colleges are considering delaying return to campus. In the hospitals of our city, which to date have had minimal admissions for COVID when you compare back to August and September, we've had a lot of folks that work at the hospital test positive and have gone home because they now have the disease. They didn't catch it at the hospital. They caught it when they were at home and gathering with loved ones at Thanksgiving and at times after that. It worries us that the therapeutics that we relied on so much for the Delta variant are not quite as effective. There are good news to come. The oral agents are being developed rapidly and should be with us soon, and that will be helpful. But many of the monoclonal antibodies are not nearly as effective. Most worrisome is that we're seeing an outbreak in children. It's not surprising. They're the ones who couldn't get vaccinated. But it's hard to know what to do with this. So therefore, for a while, the COVID committee has suggested that we be a little more cautious. We know the routine. Vaccines, the mask, and distancing are all helpful. Ephesians said to put on the armor, and so I'm going to ask you to put the armor back on as we go through these next several weeks. I would want to remind you that public health works. It's been politicized in these years of late, but public health is a really valuable thing, and we've all lived through this. There are plenty of folks out here that are my age and can remember in the 50s and 60s, if somebody developed polio, they closed the pools. This kind of stuff helps stop these outbreaks. It's done every day and has been done every day for tuberculosis. People are confined. We have a real good approach to do this, and the people that lead our state are excellent at this. Right now, as I mentioned earlier, we're only beginning to know how children are affected by this disease, but it's noted in every state that there's a rising rate of hospitalizations. So it calls on us as adults to be even more careful. I would tell you that the church COVID committee doesn't take these requests lightly. We're probably the only committee in the history of Methodism that has suggested closing down the Sunday schools and telling people not to come to church and don't show up on Wednesday night. A committee like this is probably not destined to be successful for very long. Yet at the same time, I think everybody understands the impact of this pandemic. The Stoics, who I like to read from time to time, told us that the only failure in leadership is to say, I didn't think that that could happen. So we don't like to plan for the worst, but we want to be able to protect the kids that are here, and that's part of all of this. I would conclude by reminding you again how much we all loved being here at Christmas Eve, and we'll look forward to that day. We have probably 4 to 6 weeks, perhaps 8, of rising cases. We don't know how many people will be hospitalized or will it be nearly as bad as last fall, but we're braced for that if need be. On the upside, South Africa has already seen a fall in their cases. The United Kingdom has noted less hospitalizations this go around, and the United States scientists think that our course will follow theirs. Even here in Mississippi, which we've been slow to vaccinate, this year we have about 40% of our population is vaccinated as opposed to about less than 5 1 year ago. I want to ask you to be careful, but be comforted that this is likely all to come to an end, and that we will move from pandemic status to something kind of like we treat the flu now. So hang in there and don't worry. I would leave you with the words of Joshua. Be strong and courageous, don't be frightened, and don't be dismayed. And finally from Psalms, though that the Lord is a stronghold in times of trouble. Those that know your name trust in you, for you, Lord, have never forsaken any of those who seek you.